All right, if you're a pre-PA student, a current PA student, or even a new grad, you more than likely will be experiencing something called imposter syndrome if you already haven't. Imposter syndrome is this psychological thing where even if you're a high achiever, you think that you won't be able to keep up to the standards because you don't feel confident in yourself. Even though time after time you've shown and proven to yourself that you're capable of doing everything you put your mind to. College, medical school, NP school, PA school, CRNA school, nursing school, these are just some examples of the times when people might experience imposter syndrome simply because there is so much information getting tossed to you, there's practically no way you can remember all of it. And when you get put in a position where you actually have to remember the information or apply it, you usually do pretty well in it, even in the real world after your exam. It's super common once you reach rotations, and by the time you graduate, you're going to be an actual PA or doctor or nurse practitioner or CRNA. You get the point, and you're gonna have to actually be in charge of someone's life. And that's where I think it really starts to pick up, because not only do you have to prove to yourself that you know the information, you also have to prove to your preceptor, your attending eventually, any other colleague you work with, and most importantly, the patient. All right, here are 3 tips on how to mitigate imposter syndrome from my perspective. Tip number 1, don't compare yourself to others. If you are a new grad PA, like me, I've only been working for 8 months. I'm not going to compare myself to someone who's been in my field for several years. I just don't know the same information. Going back, if you're fresh in your clinical rotations, you're not going to have the same flow. You're not going to know the same information as someone who might be in their 6th, 7th, or even 8th rotation. And going back even further, if you're a first year PA student, you're not going to know the same information that a 2nd year PA student is going to know. All right, tip number 2, don't be afraid to ask questions. It's okay if you don't know the answer. You're not going to know everything, especially if you're new into your career, if you're new to PA school. There is so much information in medicine that you need to know as a PA. You're not going to know the same as a new grad PA as you will 4 or 5 years later down the road. So when you're first starting off, it's okay. Just ask some questions. The more you know, the better you'll be. All right, and then tip number 3, jot down all of the wins that you accomplished in X amount of time. Let's say over the past week, you taught a patient something, that's a win. You learned something new that you didn't know before, that's a win. You helped someone out who, may be in a different specialty just by showing them some imaging or discussing some labs, something like that. That's a win. Count your wins. So it's okay if you have these feelings of anxiety of not knowing everything. You'll end up knowing a lot more than you think, and that will be reflective on all your exam scores, your PAN scores, and everything like that. If you have any questions, feel free to send me a DM or leave a comment down below. If you like this content and want to see more, feel free to hit that follow button. I hope you enjoy the rest of your week and have a good night.